we're here for, it's a dialogue between the health management organizations, HMOs, and the healthcare providers, that is the doctors, private doctors taking care of our people in the health insurance scheme.
Organized by AGPMPN, Association of General and Private Medical Practitioners of Nigeria, Oyo State Branch. WIS is a dialogue with health maintenance organizations, HMOs, in Nigeria. And the theme of this meeting is fair financing for quality healthcare in Nigeria.
Yes, we have come as an association that is concerned about healthcare delivery. Although the insurance scheme for health has been operational since 2005, we found out that total coverage is still below 10%. And we've come therefore today to identify some of those factors. And one of them in particular is healthcare financing. It's an aspect of the insurance scheme that we have come to look at. And we have other stakeholders, apart from those of us who are the private medical practitioners and the providers in this scheme.
You know that healthcare is high. The cost of healthcare is high because it demands professionalism and efficacious materials. But since 2005, there has been health insurance in Nigeria when the National Health Insurance Scheme started health insurance, and then many private organizations have bought into health insurance on a private scheme. And since that time, the cost of healthcare has been determined by the health maintenance organizations or the NHIS, not by the doctors or the health providers. And when they give you this pricing, the pricing is static for too long. The economy has not been static. It has been changing, but the tariff has not been changing according to the change in the economy. So it makes things like very burdensome and very difficult to keep up with. On one side, that's one side of the financing. The other side of the financing is that Nigerians do not want to put money on their personal or family health. So the premium people are ready, or organizations are ready to pay to the HMOs is not commensurate to the quality of care that they want. Nothing is static. Healthcare should be improving. Services should be improving. And if you can't improve, at least maintain the minimal best practice that will ensure good health. But with static tariff, over 5 years, 7 years, 10 years, it becomes a challenge for providers to be able to keep up with healthcare. And so we had to call this meeting to at least start a dialogue with HMO. This is just one leg of the dialogue, because healthcare financing starts with the individual who is picking up premium in the insurance scheme. It also extends on to government. It extends up to the National Assembly to give us enabling laws. If the government is not putting a good percentage of its budget for healthcare, it sells the message to people that they should not put a lot of money on their healthcare. It's as if healthcare is cheap, but life is not cheap. And so all other stakeholders are going to be dialogued with eventually, including the National Assembly by the AGPMPN.
We actually came here to have a dialogue with the health maintenance organization, the HMOs. We are the healthcare providers in Oyo State for National Health Insurance Scheme, especially for our patients. So we really came here to discuss about what we refer to as fair financing. because we realized a lot of irregularities with the financial aspect of the health insurance scheme, which is usually being monitored by the HMOs. That's why we came, so that we can have an in-between to stay concerning the quality delivery of healthcare of our patients, our enrollees.
Thank you. You made mention of fair pricing. What can you say about that, and what brought about that?
Actually, what brought about that was the fact that we realized that for the past over 5 years now, we've been having the same tariffs, the same amount of money to take care of different procedures, different treatment modalities. And when you look at the situation, the economic situation in the country, you notice that things have actually been on the high side. And all what we are looking at is, why not try and see how you can make the tariffs to be a little bit high, so that the quality of health delivery that will be given to the patient will be something that will be tantamount to the increment.
You see, if you don't have fair financing, you cannot have quality health care system. And you will know that inflation is galloping, and probably the financing has remained static. So we want to see how we are going to manage that between the two parties, that is the healthcare providers and the HMOs.
Healthcare providers that we have in this country, and talking about healthcare delivery itself, the private medical practitioners do cater for 60-70% of healthcare delivery to our people. And therefore, it's very important for us to be able to access the finances to run this scheme successfully. We appreciate the fact that there are other healthcare, other partners or stakeholders, and so we've come together to bring some of this, especially the HMOs, the health maintenance organizations, together so that we can dialogue. That is the whole essence of this forum.
Until every Nigerian, whether in the village or anywhere, has access to quality health care, whether the person has funds or not, healthcare is a kind of a right. It's a social service, but that's the social aspect of it cannot be on the doctor or the hospital. It should be national, community. That responsibility should be adequately spread out and shared and put together, so that healthcare quality can be maintained and improved.
Nigeria will improve, will move forward, especially in the financing aspect. The way forward all over the world is healthcare financing through insurance. I will want to, at this point, request that our people should embrace the healthcare insurance system, because in Nigeria it's not growing. We started in 2005, it's still under 10%, whereas in Ghana, which started after us, they are covering at least 65%. So if you want to have universal health coverage, it must be, all stakeholders must be on deck.